Hey guys, how's it going? Dr. Krafasi here with DFW Accident Injury Centers. And today I'm going to talk about rib pain, all right? Super common after any sort of accident or injury. Rib pain is very painful usually, and it's very sharp in nature, all right? So we have the skeleton here, all right? And I also have this model here, and I'm going to show you that on your back, and this is the back of the spine here, you actually have your ribs that attach to the spine, okay? And this is really important to remember because any time that you're in an accident or injury and there's trauma to the soft tissue like your muscles, your tendons, your ligaments, your nerves, well, your muscles control your joints, all right? So if I wouldn't be able to do this if it wasn't for my muscle here, okay? I just would not be able to. Your joints don't really do much. It's your muscles that are moving everything, and it's your nerves that are actually controlling your muscles. So you have to remember that if you're facing this way, you have ribs that are wrapping around the body, okay? Both sides of the body, okay? And they wrap all the way around to the sternum, all right? Now, again, if there's trauma to the spine and you're having a lot of back pain, neck pain, etc., shoulder pain, a lot of this is often related, again, and it can be related back to your ribs, all right? Now, rib pain, though, is a little bit unique compared to other types of pain. When you have rib pain, this is often very sharp and localized. So you might say, man, I have a lot of pain in this right here on this spot, okay? Now, when we're working on patients, ribs, when they're out of alignment, you can certainly feel the difference, all right? So we're able to determine whether your rib is out of alignment or out of place. And what happens when this happens is, again, because you have a lot of pain receptors inside of each of these joints, all right? So when these move out of place, it can cause a lot of pain, sharp pain. Now, it can also cause pain when you breathe in. So you might take a breath in, you might say, man, I feel that pain every time I breathe in, okay? That's usually indicative of a rib subluxation or a rib restriction, or the rib is just out of place, okay? And when we're talking about your rib, we're talking about your rib heads, which attach to the back of your spine here, okay? Now, what happens again with this is because of injuries, this is usually multifactorial. So you're most often not going to have just a rib out of place. You're also going to have a number of vertebrae that are also out of place and misaligned, giving you further pain, all right? So it's usually not a standalone type of symptom or standalone type of condition. However, you may also start to experience chronic rib pain, especially if you're in an accident or injury where ribs start to just continuously move out of place. All right, and this recurs over and over again, and this can also be related to biomechanics, the way that you're moving your body, if you're maybe at the gym or you're at home, or if you're slouching at work or anything like that related to posture. So remember that as well. But again, as it relates to an accident or injury, rib imbalances and rib pain is very common. All right, so this is an overview. I hope this made sense to you. And again, if you're feeling any sort of sharp pain in the back, okay, near your spine, it may be a rib. It may be time to give our office a call and schedule an appointment, especially if you've been in an accident or injury. All right, I'm Dr. Krafasi. Hope you enjoyed this video. See you next time.